There are two major points of particular excellence I have noticed. First, Cincinnati Children's CBDI demonstrates an excellence of coordination across all departments. Intensive chemotherapy can have severe side effects on the body, and it is just as critical to monitor the side effects as it is to treat the cancer. Over the years, I have visited the cardiology, radiology, surgical, urology, gynecology, psychology, and orthopedic departments and pediatric intensive care unit, to name a few. Knowledge about my medical history has been streamlined and effectively communicated across all departments. Every physician I have encountered knows my medical history and my medical quirks, such as low blood pressure. This level of communication sounds easy, but it's hard to execute, and Cincinnati Children's executes it perfectly. When you're undergoing cancer treatment, there is a lot to manage, and it can be overwhelming. But the teams at Cincinnati Children's CBDI take some of the burden off you and your family. It is a mark of exceptionalism, in my opinion. My poppy, Dr. James Pope, a retired ophthalmologist who has seen many hospitals, maintains that in all of his years of practicing medicine, he has never seen such an exemplary hospital where care and competence is outstanding in all positions, from the cleaning staff to the doctors. This level of care is why he made a leadership gift to fund the Cure Next Door. Everyone at Cincinnati Children's plays a critical role in the treatment of a cancer patient. When you spend extended time in the hospital, your day can be positively impacted by a kind gesture from the cafeteria woman, or the extra time your oncologist or nurse spends in your room talking about one of your varying interests. It all makes a positive difference. Not only are the people of CBDI who deliver the care remarkable, it is the care itself which is excellent and the reason why you are here today. Cincinnati Children's is devoted to research. In the fiscal year 2019, oncologists and researchers at CBDI helped produce 230 research publications. Wow. I mentioned earlier that during this round of treatment, I have felt overall healthier. This is because of progress from research. One of the therapies that Dr. O'Brien mentioned, blinatumomab, is critical to my treatment protocol. It essentially, as she explains, enables a patient's T cells to recognize the malignant B cells. The therapy is administered over a 28-day continuous period, most of which can be completed at home. This treatment was brought to the United States, as Dr. O'Brien mentioned, by Cincinnati Children's, and it is a much friendlier option on the body, and in my case has replaced many of the harmful chemotherapies I received during the first tour of cancer. While on blinatumomab, I was able to maintain a good quality of life and do normal activities. It's hard to explain unless you've experienced it, but there is something so healing about receiving treatment at home rather than inpatient at a hospital. Cincinnati Children's understands this and the importance of discovering novel therapies that have a higher efficacy rate with fewer side effects. So, rewinding a bit, a few months into my treatment, I was trying to figure out how to best utilize this extra time I had. The last time I was sick, I had high school classes and extracurriculars as a healthy distraction. But that stage of my life was over, and while my peers were busy from 9 to 5 with their jobs, I was stuck at home. I was frustrated with my situation. Around this time or so, I came across a quote that quickly inspired me to lean into my current situation. In response one day to a question asked by a reporter, Senator Amy Klobuchar said, "I believe the obstacles on the path are not obstacles, they are the path." Fund the Cure Next Door was born out of the desire to embrace my path and to say thank you. My objective of Fund the Cure Next Door was to not only raise funds for groundbreaking pediatric cancer research happening at Cincinnati Children's, but to also raise awareness of the leadership role the Cancer and Blood Diseases Institute serves in the pediatric oncology community, as I hope we have accomplished today with you. I wanted people to recognize and appreciate this incredible resource that we had right next door. No gesture or thank you will ever adequately express the gratitude I have for Cincinnati Children's CBDI. It has given our family and so many others hope when it appears there is none, and for me, that is priceless. would not be here today without the exceptional people and the research at Cincinnati Children's Cancer and Blood Diseases Institute.